Insurance is one of those purchases that so many of us make, yet so few of us really understand how it works. And therefore, because we don't understand it, hundreds of dollars are wasted all the time because we either purchase too much insurance for our needs, or we just completely buy the wrong stuff in general. So no matter what age you are, where you live, what activities you participate in, whatever your health is, there is always a chance for financial loss due to some kind of tragic, unforeseen emergency within our health. Having an emergency fund is by far one of the greatest ways that we can kind of cushion the impact of these health-related financial emergencies. So if you don't have an emergency fund already set up for yourself, I definitely recommend that you get started on that first and foremost. If you don't already have an emergency fund in place, I highly recommend grabbing my gospel-centered budgeting planner that will help you build up your savings in order to be prepared for any kind of financial emergency, or even just saving for different financial goals that you have for yourself. Getting an emergency fund set up is a fantastic starting point for your financial journey in regards to health-related expenses. However, having medical insurance does help ensure that this emergency doesn't turn into some sort of catastrophic financial crisis. At its bare minimum, health insurance does help to transfer the risk of financial loss due to major unforeseen events. Now, health insurance in general can be very expensive, and it's also just not a great fit for everybody. There's definitely some benefits to traditional health insurance, but in this video, we are going to talk about alternatives to health insurance. Now, if you've been following me for a while, you probably know that I am a big supporter of health cost sharing ministries. These are similar to, but different from, traditional health insurance. Most of these ministries do work very similarly to traditional health insurance, where members pay a monthly membership fee to have their medical expenses shared within the group that they are a part of. So here are a few quick points about health cost sharing ministries if you are not familiar with them. First, they are not insurance. These plans are not regulated like traditional health insurance is. They are community-based, where members contribute to a shared fund, and the funds are used to help other members with eligible medical bills. They typically have lower monthly costs compared to traditional health insurance premiums. They are often faith-based. So many of the sharing plans, members need to adhere to certain lifestyle choices or beliefs. One of the benefits of participating in a health cost sharing ministry is that the ministry gets to set their own parameters for what medical expenses will be shared by the members. So medical expenses that do not align with the ministry's beliefs are not shared within the participating members' fees. So examples of this might include things like abortions, drug abuse related incidents, birth control, or even cosmetic procedures. Because of this, they do have limited coverage, so they might exclude certain services or conditions that don't adhere to these lifestyle covenants. And in many cases, the ministries don't cover certain preventative care or wellness visits. This does, however, make the monthly membership dues much lower. There technically is no guarantee of coverage for your medical expenses. However, this has never been a problem for us as long as you understand what the guidelines are for the ministry. Now, some programs don't have network requirements. This allows members to choose their own preferred providers. And this is honestly one of my top favorite things about the health cost sharing program that we are a part of. So as long as the medical expenses in general fall within the sharing guidelines, we can actually choose whatever provider we want to go to based on our own desires. And the one thing that deters a lot of people from joining health cost sharing ministries is that they often work on a reimbursement model. This means that members pay for their medical expenses out of pocket or upfront, and then they submit their bills for reimbursement. So we actually typically pay for most of our expenses completely out of pocket and then send our bills to our program, and they send us a check to reimburse us for those expenses as long as they are within the guidelines of the ministry. Now, this is different from traditional health insurance because health insurance is regulated by state and federal governments. Insurance plans offer a range of coverage, including preventative care, wellness visits, and treatment for various conditions that health cost sharing ministries may not cover. Now, members pay monthly premiums, but on top of that, they might have high deductibles, co-pays, and co-insurance. Health cost sharing ministries typically have some form of a deductible, and in certain circumstances, they may have co-pays, but for the program that we're a part of, we don't have co-pays, and our deductibles are very, very manageable. Insurance plans often have provider networks where members receive discounted rates for care, but they have to go to providers who take their health insurance. Again, this is one of the things that I dislike most about health insurance, is that you have to go to the providers that are within your network, even if they are people that you don't prefer going to. Now, health insurance providers do have a level of financial protection against high medical costs because they do have guaranteed coverage in most circumstances because of their ACA compliance. So they do have to comply with the Affordable Care Act. That means they must cover certain essential health benefits that the government has deemed within the Affordable Care Act. So this means that you, as a member of the health insurance plan, may be paying for expenses that you don't agree with. This is also one of the reasons that traditional health insurance tends to be more expensive, because they have to cover so many more medical expenses for everybody. Some well-known health cost sharing ministries are MediShare, Christian Healthcare Ministries, and Samaritan Ministries. My husband and I have actually been members of Christian Healthcare Ministries for many years now, and we really, really enjoy being a part of this faith-based medical cost sharing community. If you aren't familiar with them, I have created a ton of videos on Christian Healthcare Ministries. All sorts of questions will be answered in those videos, including what do they cover for maternity-related expenses and how to manage your bills if you do have to do the paying up front kind of thing. So if you have questions, you can definitely drop them in the comments below or check out a number of the videos that I have linked in the description. Now, if you are a part of a health cost sharing ministry, or if you've now been paying attention to what I've been saying about health cost sharing ministries, you know that they don't cover certain medical expenses such as dental, vision, routine checkups, small sick visits, as well as ongoing prescriptions. This may seem like a lot of different expenses that you would now have to pay out of pocket. However, our family and many families across the United States have found that medical cost sharing programs are still more affordable than traditional health insurance, even when you are paying for some of these expenses out of pocket. Now, I want to share a few of these tips on how to keep costs low and affordable for your family, even if you're paying for these things out of pocket. So the first is dental costs. Christian Healthcare Ministries does not cover dental or optical related expenses unless they are related to a larger incident, like getting hit in the face with a baseball and needing like dental surgery. Now, dental insurance can often cost around like $30 a month on average, or somewhere around $360 per year. This might not sound like a lot, but if you are someone who doesn't need a lot of dental work and you take pretty good care of your teeth, dental insurance might be a complete waste of money for you. Because at $30 a month, that might not sound like a lot, but you may still have some sort of copay when you actually go to your visit. With dental insurance, there is not always a clear picture of your out-of-pocket costs. This is because certain services may not be fully covered or covered at all. Your dentist can estimate specific dental services for you with your insurance that you have. You may not know how much you actually have to pay until after your insurance claim is processed. And you might get hit with a very large bill afterwards that you would be stuck with. And this can really derail your monthly budget. However, by paying cash up front as a self-paying patient, you actually know how much your dental services will cost, and you can plan for that on your budget. Now, one last thing to mention about dental insurance is, again, that whole in-network versus out-of-network. You might find really affordable dental insurance, even as low as like $15 a month or something like that. But you have to be careful because not a lot of providers often accept that form of dental insurance. And so you might be paying really low premiums, but then have to go to a really low tier dental provider. That's also one of those like cost benefit things. Okay, you might be paying a lot less, but you might make up for it in the fact that you might have a really not so great dental provider. So be really careful about that. So instead of dental insurance for us, we actually have a dental discount plan that we pay directly to our dentist. We pay for it on an annual basis, and it covers 2 cleanings and x-rays for the year. We also get discounts on other necessary dental related expenses such as needing fillings or something like that, but we take very good care of our teeth, flossing and brushing and doing all the good stuff that we haven't actually needed to pay for any of those other expenses. Now, generally, dental discount plans can range anywhere between $150 to $300 a year, which is already less than dental insurance. Now, if you'd like to find a really awesome dental provider that takes self-paying dental patients, I highly recommend using OpenCare. We actually found our current dentist through OpenCare, and we actually received a $50 Visa gift card for using OpenCare. So if you use my referral link to find a dentist with OpenCare and then go to your first appointment, you can receive up to $100 back when you find your dentist, which is super awesome and obviously can help cover the cost of your first dental appointment. Now, the next thing is vision insurance. The Vision Council reports that around 164 million American adults wear glasses or contacts. So if you are one of them, like I am, you probably know that glasses and contacts can be fairly expensive. Now, the average American actually pays $127 for frames alone. So that doesn't include like the actual lenses. Vision insurance is very similar to dental insurance. It often doesn't cost very much and may seem really affordable. And it's like, yeah, why wouldn't I get this? But it doesn't make a lot of sense unless you expect to need a lot of work done on your eyes. I highly recommend just going straight to an optometrist and paying for the appointment out of pocket, and then asking them if they have any kind of discounts for glasses, contacts, and the likes. Otherwise, there are a ton of national programs that offer free or low-cost eye exams and eyewear to people with limited income. So you need to meet certain income criteria and other requirements to qualify, but some of those programs include Eye Care America, Lions Club International, New Eyes, and One Sight's on-site voucher programs. I'll have links to that kind of stuff in the description below so you can check them out to see if you might qualify. Otherwise, I also recommend checking out some optometry schools near you because they often offer very low cost or even free vision exams. The next thing I want to talk about are your routine visits like your annual physicals or even just wellness visits, if you get sick or something like that and want to see if you have like strep throat, I highly recommend checking out a direct primary care provider rather than going to a traditional family doctor or primary care provider. So with a direct primary care provider, you pay a flat monthly membership fee, usually around the size of your cell phone bill. Now, if it seems like everything these days is going to this subscription model, this is because it really is the best and most affordable way to get high quality service and excellent support over a long period of time. So if you think about something like Netflix, consider if Netflix decided to nickel and dime you every time you wanted to watch your favorite episodes of Stranger Things. Now that would be awful, having to pay per episode or per minute. No, this is why something like Netflix does really well with a subscription model, because you pay a monthly fee and you get unlimited access to all of their shows. Now, practically speaking, a direct primary care is a membership model or a subscription model for health-related expenses. Every patient pays a flat fee for the month and you become a member of that practice. There's tons of different services that are provided. Some of the things are getting unlimited visits at no additional charge, so no copays or extra fees. You can go in as often as you need to. Most places nowadays also offer unlimited telehealth appointments or even just over the phone consultations. Many of these providers have same day or next day appointments. A lot of DPC providers also give you their cell phone numbers or a text line that you can send messages into. This is really awesome because, like, for us, we actually have a DPC provider for our son. So we've been able to take pictures and send it just via text message to be like, does this rash look suspicious or anything? Or do we need a prescription for this? So this has been really, really beneficial for us. I do have a link in the description for a DPC mapper so you can find your local direct primary care providers and see if they have openings for new members. The next thing I want to talk about is prescriptions. This is not something that I have had a lot of personal experience with. Our family is generally very healthy. We don't take regular prescriptions at all. The only prescriptions we've ever really taken are for sicknesses or things like after a surgery. So I do have a link in the description to a place called Prescription Hope, which helps to make monthly prescriptions more affordable. So you can go and check those out as well. Vaccines is another thing that Christian Healthcare Ministries does not cover, and a lot of health cost ministries do not cover these. So if you are someone who wants to vaccinate your family, I recommend actually going to your local Department of Public Health and not to your primary care, because your primary care provider will need to charge you full price for these vaccines, and they can be hundreds of dollars. Your local Department of Public Health often can offer them for free or very low cost, so check those out. Another place to consider would be like Walmart or Walgreens. They typically offer low cost or free vaccines depending on the vaccine that you're interested in. The last thing I want to talk about is the best and ultimate way to keep your health costs as low as possible, and that is to prioritize your preventative self-care. So what do I mean by this? I mean eating and switching your diet to whole organic foods. Think like shopping the outside parameters of your grocery store rather than the pre-packaged, like pre-made foods that are often in the center aisles of your grocery store. Food is literally like the best medicine for your body. God really designed food to sustain us perfectly, and eating heavily processed foods is one of the main reasons that we are all so sick and go to the doctor so much. So by simply changing your diet to nutrient-dense foods, you will begin to heal your body in ways that traditional synthetic medicine really just can't do for you. Some other things are just drinking plenty of water, getting 8 hours of sleep at night, spending lots of time outside because getting vitamin D through food is much more difficult than getting it directly from the sun. Vitamin D is one of the best ways to build up your immune system and avoid getting sick in general. Some other things are just being active several times throughout the week and taking care of your dental health by brushing 2 times per day and flossing. By doing all these things, you really can avoid going to the doctor as much as possible. Obviously, there are still emergent things that happen, like hurting yourself and needing to get surgery versus getting a chronic illness. Taking care of yourself is definitely the best way to prevent going to the doctor in the first place. I highly recommend it. If you're looking for just general financial tips on how to start to afford these things and get into the rhythm of budgeting for preventative care, please feel free to grab my budgeting planner. It's totally free in the description box below.